Hello and welcome, Harvey Olivia. I have the Respiratory Guy on videotape, Mr. Houston.
Greetings, everyone.
And we are going to do our competency for chest percussion and postural drainage. So, like everything else, when we start out, we have to verify the physician's order, make sure we have an order for anything we're going to do, make sure we check the patient's chart. Then we go ahead and do our proper PPE, so I would have gloves on and anything else that would be necessary before I enter the patient's room. I'm going to also introduce myself to the patient. Hi, Mr. Tim, my name's Harvey. I'm with Respiratory. The doctor ordered some CPT and postural drainage, so I'm just going to go ahead and get ready to do that. Is that okay with you? The patient can either say yes or no. Sometimes what I find out is that the patient may have eaten something just recently and they might tell me to come back later. Totally acceptable. Anything that's going to make the patient more comfortable, try to accommodate them and come back at a later time, especially if they just ate something. So once I go ahead and get the okay from that, I'm going to go ahead and get my supplies ready. So I do have a few different devices. This one is an electronic percussor, so you would turn it on and you can set the vibration and the power to what you want it to have. I prefer this attachment over this one, but it's up to you, whichever one you want to use. These are for manual, so you would hold this in your hand and then you can hear the sound. You can also take an ambu bag mask and put some tape on the end and use that. And then you can use your hand too. And then we also have the vest. So this is a chest vest. And some hospitals do have the percussion vibration built into the hospital beds as well. So once we go ahead and get our stuff together, I'm going to put the patient in the position that I want. Now we have several positions that we can use. I'm not going to go over all of them for time's sake, but here is a screenshot of the ones from your book. And you can look those up on the web as well. And they will kind of give you some suggestions on the positions you can use and what's going to benefit the position you want so that you can be effective. So if I wanted to focus on one side and one segment of the lung, I might position the patient in that particular position so that I can focus on that lung. But just for demonstration, I'm going to go ahead and show you. So we're going to start on my mannequin. So you can do your hands like cups like this. And then the book recommends to do it on exhalation. That's kind of an old school thing. I don't really use that anymore, but I prefer to use the devices over my hands just because my hands get tired. So I'm going to go ahead and demonstrate with this. So now I want to ask the patient, is that okay? Is it too hard? Are you uncomfortable? Be mindful of any kind of issues the patient might have and make sure that there's no reddening or any kind of discomfort. So you want to focus on different areas. You may have to do the back. You may have to have the patient positioned to the side so that we can do different areas. So this is with the mask. This is with our little cup. Now they do make these in different sizes. We do have tiny ones for kids and we do have one that's just a little bit bigger than this. Okay, and then we have the electronic one. Normally I would put some kind of cover over this. Usually I take a glove, or like I said, I would use this attachment that already has the cover. And I would start by turning this on and just, go ahead and do a circular motion. Make sure that the patient's okay with it. Make sure it's not hurting them or too strong. And then you want to encourage them to cough as well. So along with that, you also want to make sure you have suction equipment by, which I do, in the event that the patient is able to cough up some stuff. Then we have the vest. So the vest has tubing. A lot of times it's single patient use and disposable. Sometimes it is not, and you need to clean it off and get it clean and get it ready. This is the vest that comes in different sizes. So you may have large, you may have medium, you may have small, and you may have different variations. Some are actual vest, and some are just over the stomach. So just for demonstration purposes, I'm going to put it on myself. And then you have a plug that goes in here. So unwrap your plug. Ours is decorated with Bugs Bunny. but in the hospital it's just a regular. There's no decorations on it. Then you do have a Velcro here, and that's going to hold the tubes in place so that they don't come out as easy. And this is a paper single patient use. I'm going to go ahead and tear this off, but leave it for the students to see. And then you can only go one way, so if you take your finger and it goes through, you know you're going the right direction. If you go the other way, you're going to hit the stitching that's in here and you cannot pass. These little things are to help you pull it open, so you can go ahead and slide that in. And they do tear easily, so just be mindful that these might tear. Okay, I'm going to go ahead and put this other one on. And once I'm happy with my placement and how far they're in, I'm going to kind of give them a little extra support with this strap. Okay. And then now I have this turned on. It comes up with a normal screen. You can make adjustments on this. You can adjust the time, the strength, the frequency. So you can make all kinds of adjustments. And again, these are different sizes, so one size might not fit some, everybody, so you might have to get different sizes. So I'm going to go ahead and turn it on, start the therapy, and as you can see, it starts pulsating, and I can go different speeds, and I can try different times, and then I can turn it off. Okay, so that is another device that we can use. Then once I've done the procedure with the patient, I go ahead and check their vitals, make sure that their pulse is good, respiratory rate's good, color, ask them if there's anything I can do for them, ask them the position that's comfortable. So then I'll ask them, do you want to stay in this position, or would you like for me to lower the bed? So anything the patient would request, I would accommodate that. I would clean up my mess, I would document everything, and I would be done. Thank you. Have a wonderful day.